better? Laying them down?
No. Yeah.
Like that? Look.
What's up, everybody? Yes, perfect. That's perfect. Oh, nice. Hey, how's everybody doing? I see D. Lynn, Debbie, what's going on over in Australia? Roel, can you guys hear me okay? Different spot, obviously. Let's see here. We're going to let a few more people come in. I'm live on Instagram up here. Hello, Instagram. I see you guys. Hello. Interact a little bit. Okay. Foxy Moxie, what's up? Bettina from Canada. Hello, Jerry. Thank you. Thank you, Roel. Let's see. Grandma Mary, what's up? Oliver. Yes, we're getting a lot of comments about the room. It's cozy. I'm going to be live with Dr. Rogers today. Tom, my brother, what's up? I believe the organic working twins are going to be here tonight. That's right. Okay, y'all can hear me well. Thank you, guys. Thank you. Don't have my mic here. That's why I asked. I've got my mic here that I'm going to turn on for the podcast. If you guys don't know, the podcast version of the live Q&A goes up a week later. So if you miss it, you can always catch the other version. Michelle, I see you. Let's see. Hello. Donna, what's up? All right. Thank you guys on Instagram for watching. Oh yeah, Roel, what did you think of this? I want to ask Roel about that. What did you guys think of the one with Dr. Edwards? I just told my mom over dinner she needs to listen to that ASAP. Stan, what's up? Let's see here. Real quick, I'm going to put that up for you guys. Thank you, Roel, for that. If you guys got questions for Dr. Rogers, go ahead and put it in the comments. This is what Roel's talking about, Beyond Biology, the Emotional and Spiritual Roots of Disease. Definitely check that out. Super, super cool. Dr. Edwards was on our podcast a couple weeks ago around the Texas measles outbreak. He was on the front lines of that. He actually, went out and dealt with, I believe it was a Mennonite family and helped them. The family who had one of the kids passed away, so he helped the siblings. And then let's see here. I'm seeing some comments. Thank you, Tom. Thank you. Cherry, what's up? I'm gonna put this up. What Tom's talking about. Let's see, a paper to EMR. You can see my brother there going digital. Check this out, especially if you're a patient. This is basically just talking about, why we are transitioning to an EMR system, an electronic medical record system, what that means for you, what that means for us. That's my mom. We got the whole family here tonight. Hey, Mom, say hello. I love the effort. That was good effort. I see Bo's in here. What's going on, Bo McGregor? I love it. The Complete Wellness Blueprint. What's going on? I'm going to wave at you, Bo. What's up? Thank you, guys. Bo, I know watched the episode. We watched it live with Dr. Edwards. Thank you, Jerry. I take that as a huge compliment. Mark, I got it. I know. I'm with you. I got you here shortly. My brother Steve's in the building. What's up? See here, Ike's in the back. Ike, say hello. He's scratching on me. Angie, what's up? Great to see you. All right, we're gonna have a fun time. I see Esty Bestie, my Esty Bestie's in the house. Jasmine, what's up? Great to see you. Happy Tuesday. I hope everyone's having a wonderful evening tonight. Thank you for spending it with me. Your realtor, Sean, what's going on, man? Thank you. Thank you for being here. Miss Cindy, what's up? Thank you to all the Instagram people. I'm watching you up here. And we got Facebook, YouTube, everywhere over here. All right, we're taking questions. So if you have questions for Doc, go ahead and put it in the comments. Shoot. Oh, shoot. There's my phone's up here. I'm going to have to figure out how to get to my email. We'll see how to do it. That's my phone right there. Come on in. Let's rock and roll. Linda, what's up? Great to see you. Let's see here. Different setup. We're getting used to it. There's Doc.
Hello.
All right. Let's see.
I don't even need this, do I?
You do here in just a second. All right. We're recording. Hey.
Hi, Ben. How are you?
What's going
Great
on?
to be here in person with you.
I know. This is new and this is cozy.
Very
Getting a
cozy.
lot of comments on
Very
the
cozy.
coziness. Barbara, what's up?
Does anybody know what that is in the very background?
That's I
Not you. You know what it is. In the very back beside that window.
We're getting coached here.
It's in my little part of my gym.
Ooh, D. Lynn, I love that question. Motaz is in the building. What's up? Thank you, Motaz. See Motaz there. You see him right there? Down there at the bottom. There we go.
Oh,
All right. If you guys got questions for Doc, go ahead and put it in the comments. And I'm going to see if I have my email set up here. And I don't think I do. But I'm going to check it out either way. I do not. That's okay. I'll figure out how to get to that question here in just a second. Okay. I see Mark. I love that. There we go. Edna, what's going on? Evangeline, what's going on? I know. See, Evangeline, about time I visited my dad. Yeah,
I know. We're
Here we
glad
go
to
in
be
person.
together tonight. We even played pickleball tonight.
We got to play pickleball. Well, it was earlier before it rained.
Yeah.
We got
Had a
lucky
great
with
time.
that.
Got a lot of good games in, but that's a teeter board in the background of this. That's where I hang upside down to decompress my back. That's what it's called.
Do you think that helped you?
Yeah.
What are some of the workout things you're doing right now?
Um,
I know Tom wants to know. See,
well,
Tom's been getting honest about the reverse hyper. You got to get a reverse hyper.
no, I need to get that. Yeah, I'm gonna look into that for sure. But a lot of pickleball, a lot of biking, a lot of calisthenics, bands, push-ups, pull-ups.
You did mention to me, you told me, Ben, I want to get in better shape. You mentioned that today. What's your plan? Like, what are you thinking you're going to do? Are you going to change up anything?
I need to do more HIIT training, sprinting and things like that. But I want to have fun too. I'm 70 years old, and I want to have fun.
Yeah.
While I'm doing it. So I love biking. I love pickleball, but you have to work on your muscles. Like Tom was saying, you need to work on your muscles.
I've already gotten that. I got a comment.
You'll never live that down, Tom.
I want to put this up for so Tom said an inversion table, so that's pretty much what it is.
Yeah.
I'm gonna put this up for everybody. The bicep vein. I mean, come on. Thank you, Roel.
Yeah.
Thank you for that.
You got a vein running up there.
I see. Okay, cool. I see your realtor Sean up there around the NAD plus, and I let's see. Thank you, Bo. Okay, question around NAD. Super cool. Thank you. Is it California Kiwi? What does that mean, California Kiwi? Let me know in the comments here. Trying to be in both places here. Apologize if I get distracted. Okay. You don't happen to remember, we got an email around a question. Do you remember what it was?
No. Last week?
No, just now.
You asked me.
Yeah, I told you to look at it. It was in my.
Is that about the NAD plus, long COVID?
No.
PMR?
No.
Maybe.
Let's see. Does anybody know if I can go to my email, but be on live? What we're gonna do is we're gonna go ahead and take the live questions first, and then we'll get to the question that came in through my email 10 minutes ago. And I don't know how to access my email at the moment. Actually, yes, I do. Yes, I do. I'll figure that out. Okay. If you have a question for Doc, go ahead and put it in the comments, and we're going to rock and roll. Will you grab my my computer, and I'm going to use that. Okay. We're going to get to everybody here. Let's go to Debbie here. Hi, team. I'm wanting to go more carnivore with my diet. Do you think it's okay for a type 1 diabetic? And how do I calculate my insulin dose for significant protein? It's a great question.
Well, that's a really good question. I wish Andy was on here tonight instead of me, because being a type 1, he was on here last week.
He was. Yeah.
Yeah, I love the carnivore diet. First of all, I call it carny. But I try to stick to a carnivore diet if I can myself. It's very hard just to eat meat. So if you read the carnivore code and talk to Dr. Salandino, he's added fruit to his regimen. So the problem that being a type 1 diabetic, if it's a problem, is that it's not a problem. You're going to have to go way down on your insulin dose. You're going to have to really lower it. There's no formula that I can tell you about, because everybody's different, especially every type 1 diabetic is different. You just have to look at your CGM and slowly lower your insulin dose. Because if you're not eating any carbs, you're going to have to really go down, almost half it, and then be ready if you drop out to treat the hypoglycemia. But I really do like a carnivore diet, especially if somebody's guts messed up, or they're having particular dysbiosis. There's a couple things you can do if you're having a lot of problems with your gut. Number one, stop eating. Do some fasting. And a lot of times that will straighten your gut out. Put your bowels at rest. Yep. That's what my dad used to say. And the other thing is switching to a carnivore diet, because your blood sugars aren't going to swing that wildly when you eat carbs. You won't have to cover the carbs like you do with your CGM right now, or your sliding scale. I don't know if you're on a pump or if you're on the shots. If you're taking a long-acting shot like Lantus or Levemir or one of those. So it's just so individual. It's hard for me to give you a formula, but you might even want to work yourself into it, like slowly increase your protein and see what happens with your sugars while eating some carbs, and then slowly wean them down and accordingly cut your insulin level down. Some people do it by 5 units a day. Some people do it by 2 units a day. But just be aware. And if you're a type 1 for a long time, you know your body. You usually know what drives your sugars up and what takes them down. So play around with it a little bit. That's all you can do, because there's going to be no endocrinologist that's going to recommend that to you or know what to tell you. You're going to have to figure it out yourself with your blood sugars. And now you have the tools to do it with your CGM, and you can follow really closely and have something ready in case you drop off. Again, I'd rather see an elevated blood sugar than a lowered sugar level for a type 1 in an emergency. Yeah. So just be careful that you're not driving and that you drop your sugars out. We've watched that a few times with my kids. It's very dangerous. So, yeah. As a type 1, especially as a kid, you can be pretty brittle. I remember they would go from 550 to 25 in an hour without doing anything. Yep. So it's tough.
And they always had glucose tablets.
They always had glucose tablets ready, and some juice and things like that. Peanut butter. Yeah. But so try to gradually work over to the carnivore diet. I like the carnivore diet. I really do.
Debbie, thank you for that. Let me know in the comments if that helps. Real quick, guys, I'm going to read from an email we just got. I apologize for the setup here, so I'm just going to read it.
Let me say one more thing to Debbie.
Please.
If you eat, you always, as a diabetic, should check your kidney function, and for microscopic proteinuria. So that's another little thing, kink. You got to consider that if you're spilling too much protein in your urine as a diabetic, that means kidney damage. So make sure you follow that before you just bust loose with a very high protein diet. Unfortunately.
Yeah. Thank you for that. And Debbie, thank you for the question there. Hope that helps a little bit. I see you guys on Instagram. If you have a question for Doc, put in the comments. I see your realtor, Sean. California Kiwi is in California. Grows kiwis. I love it. Okay, this came in through email. Thank you in advance for everyone who's sending in questions through email. And I'm just going to read it out loud for you. Is that cool? Okay. All right, so I'm going to read this out loud, guys, and then we'll get to the live questions again. The question is, I either had long COVID or polymyalgia rheumatica from February 1st, 2024 to February 1st, 2025, 1 year to the day. The inflammation is gone, but I feel my joints have taken a toll, feeling a bit damaged. I took BPC 157 in pill form for 1 month. In January of 2025, March 1, or in March, I took BPC 157 in the injection form. So 2 questions here, Doc. Any suggestions as to why, to what might be helpful now after these 2 forms of BPC 157? And then the second question is, what do you think about NAD? I see some people on Instagram asking about NAD. So let's start with the first question. Any suggestions as to what might be helpful now?
Well, it's hard to say. It could be either one. Long COVID, of course, can trigger an autoimmune disease like PMR. But usually PMR, it's not that common. It usually happens to people over 50, usually 70. But more women than men get it. It's another autoimmune disease of unspecified etiology. Some people think that it can be triggered by a viral illness, certainly. But it's a pretty severe type muscle and joint pain. Usually starts in the shoulders, sometimes associated with temporal arteritis. Another word for that's giant cell arteritis, which is where your arteries get inflamed, particularly an artery in your temple, and it can lead to stroke. So if you have a severe pain in your temple, that's a sign that PMR has led to temporal arteritis, and that's an emergency type situation. And really, the only way to diagnose that is doing a biopsy of your temporal artery. But you can get clues, and you can really cool it off fast with prednisone steroids. So if it's really cooled off fast with prednisone, you'll know it's probably PMR, because nothing responds that quickly besides PMR to prednisone, even a low dose prednisone. But usually to make the diagnosis, your SED rate is going to be very high. So it's sometimes a hard diagnosis to make, but it sounds like you got better. You had it for 1 year. You're saying January to January?
January to January. Yep.
Yeah,
February to February.
So I'd be interested in seeing what you think helped you. Was it the BPC 157, which I love? I take it every day orally.
Orally?
I take oral. That's one of the few peptides that really works well orally, especially if you have gut problems. It also can sometimes trigger any autoimmune disease. But in the injections, when I've used them personally and for patients, is usually like when you have bursitis, or you've injured a particular muscle or joint, and you shoot it into the skin around that joint daily. Say you're trying to heal an Achilles, partial Achilles tear, or even tennis elbow, or things like that. You inject it for 30 days in a row, subcutaneous, right near where the pain is, and it really works really well too. But so I do like BPC 157 in general. It's really effective, and maybe that helped you. Maybe it kind of ran its course. I don't know if you did anything else for it, like took anti-inflammatories or even prednisone. I don't know what you did, but what was the question? NAD plus?
So
did that help?
So the first question was any suggestions as to what might be helpful now after the BPC 157, and then what do you think about NAD in the nasal spray or injection form?
Yeah. So sounds like you've pretty much gotten rid of the inflammation. You're not having that much pain, but now you're afraid you've done some joint damage, which could always be a possibility. Certainly, I do like NAD plus, and you can get it orally. It's not that great orally, but I like the injection form better. We worked a little bit on the nasal sprays. Haven't found
for NAD.
NAD plus.
Yeah.
It's not as effective as the shots. So the new thing, everybody's calling our office. I want the NAD shot.
Yep.
Or even in an IV. And the IVs are kind of tricky. We've given a few of them. People really get this heavy feeling. They flush. They feel really uncomfortable. The shots don't tend to do that to them, the subcutaneous shots. But a lot of people like them. The purpose of them really is to produce cellular regeneration and energy. So if you're really tired and you're hurting, and it might help you a lot. But it sounds like to me the worst problem you have is your joints are wearing down. It'd be interesting to see how old you are to kind of know what we're dealing with, because joints wear out a lot too. I like PRP if it's joint specific. If it's all over, you're probably not going to do PRP to most of your joints. I find PRP works better in large joints anyway, shoulders and knees, hips. It doesn't work that well in small joints. But I always think of doing the other stuff too, like taking boswellia, curcumin, willow bark. There's a lot of things, MSM, a lot of things in that pain formula.
I was thinking the pain formula, would that be good for like a joint issue?
I take it every day. Yeah. I like that pain formula. We spent 2 years trying to formulate. It's gotten rave reviews, and it's a daily medication. It's not for as needed headaches or pain. It's meant to be taken on a daily basis. But those are some of the things you can do. Another trick I've used that I think is pretty effective is by using olive oil, pure virgin olive oil, drinking a tablespoon of it every day.
Drinking it?
Yeah.
Huh.
I do it.
Interesting.
When I can think about it.
Do you have is there like a brand you like?
I get the Divine brand.
Okay. Because
It's
olive
gotta be-
oil, like there's a spectrum of like
There is. You have to get
good to bad.
You have to get extra virgin olive oil. It has to be good stuff.
I'll be interested. I think Steve's in here. Steve, do you have a suggestion with olive oil? I know you're like super, good with stuff like that. If there's an olive oil or anyone in here,
Just taking it straight. Just taking a hit of olive oil.
Yeah.
I suggest that over a hit of vodka or alcohol. Much better for you. It's really good for you.
Your jokes are funnier in person. That's
Yeah?
why. Yeah, like I got that right off the bat.
Really? I never wonder why, you never get my jokes. So maybe it's in person, because everybody else thinks I'm funny. The twins don't think I'm funny. I thought it was a generational thing, maybe.
That was really funny.
I'll try to come up with another
That was
one.
funny. I'm
I'll
gonna
try
get
to come up with another one.
I see Brandon's in here. Brandon, what's going on, my brother? We got a few questions around NAD. I want to get these up real quick. Your realtor, Sean, is asking, let's see, before that, hearing a lot about NAD, a 50-year-old woman, do I need it? And what the heck are peptides? It's a great question, California Kiwi. What's your thoughts on this for California Kiwi? So what is NAD, and do I need it? Essentially, 50-year-old woman, and then what are peptides?
It's niacinamide adenine dinucleotides, a chemical name for it, but it is a peptide. And a peptide is just a string of amino acids that have signaling processes to where they turn on another function in your body, almost like a hormone, like the sermorelin and ipamorelin. They really turn on your own production of growth hormone. So peptides are just different combinations of amino acids that stimulate another part of your body, mostly in the healing realm. Because like NAD, plus as you get older, you produce less and less of it. So certainly as you get past 50, you're going to put out way, way less.
Yep. Just
like your body naturally produces less growth hormone as you get older. And growth hormone is a repair hormone. But so peptides are kind of a safe way to take things that stimulates your own body to produce it, rather than taking a a synthetic medication. So I think peptides are fantastic. There's so many. You should see some of Robin Riddle's explanations of peptides, and there's so many different ones. Insulin's a peptide. So many uses are very helpful in a lot of different ways. They're kind of specific in the actions that they produce. So look into peptides. Look at some of Robin Riddle's on our site as far as explaining some of the different ones that you can take, because people that do longevity medicine all know about peptides.
Yep.
They're very helpful.
And I'm seeing here from your realtor, Sean, there on Instagram. Do you think with the change in leadership at the FDA, we will see more peptides open up for doctors to prescribe, such as BPC 157 and more?
Yeah, I really do. I really do think that will happen. But because now we've got all these great people in there that are really on top of it. You couldn't ask for a better lineup of healthcare leaders than we have in the administration right now. We've got Casey Means has been nominated for
we're pumped about that.
Surgeon General.
Yeah.
You know, read her book that I gave all the PAs and nurse practitioners. Fantastic.
Good energy.
And we've got Dr. Bhattacharya out of Stanford, who was a co-writer of the Great Barrington Declaration, saying, leave this COVID alone. You know, quit doing what you're doing, stupid stuff you're doing with COVID. He got castigated for it. And now he's going to be in a leadership position. We have Dr. Oz. We have Dr. Makery out of Johns Hopkins, who's one of the most published doctors in the world. And they're all thinking like we do. They all like this functional integrated medical approach to where we can find the root causes of diseases and attack it from that way. But however, the drug industry, pharmaceuticals, a big player. They're big lobbyists, and they're very powerful, and they do not like, they've controlled the FDA. So there's going to be a process where hopefully they're getting rid of a lot of those people right now. I know it's causing a big stir, but really it's a great thing because we need to change. And look at our country. We're not getting any healthier. We're getting worse. We're spending these billions of dollars of wasteful money, and we've got these overweight, sick kids all over our country. It's unbelievable. It was way better when we didn't have any of this technology. It's because they've screwed it up and taken away a lot of the common sense to where we're not looking at the root causes of diseases. We're inventing diseases so we can make a drug for it, call it something that has a code on it, and make billions of dollars off of it. Now, there are great medicines out there too, like the GLP-1s. I'm a huge believer in it. So it's not all like that, but I'm really, really pumped up. And as a matter of fact, Trump just signed an order yesterday to get these drug costs down. I've told you the story many times about one of my patients that came to me from Knoxville for narcolepsy, and
yes, I remember this.
Prescribed generic Provigil, modafinil, for him. He drove back to Knoxville, went to CVS, calls our office back. I can't afford this. It's $750 a month. And I said, put the pharmacist on. I can't believe that. I get the pharmacist on there, and I go, are you using generic Provigil called modafinil, and it's $750 a month? He said, yeah, that's what we charge for it here at CVS. So I said, well, I got the patient back on the phone. Don't get it. We'll find out a better price. So we find it on GoodRx for $35 a month. And that's what Trump is going to stop.
Yeah. We're
going to start as a country paying the same prices these other countries pay. You know, there is a lot of R&D cost up front, but there's something off. And it's just crazy. There's no transparency to it at all.
Yeah, there shouldn't be that much discrepancy.
Yeah, it's just crazy. But anyway, so I'm very hopeful that we're going to turn this thing around and become healthier as a nation, because we have better leaders in there that aren't bought out by the pharmaceutical and the insurance industries.
I love that topic. Thank you for bringing that up, Realtor Sean. Katie, I see you. Thank you so much for everything today. I can't wait for the rest of this week. We're going to have a big week here at Performance Medicine. Dennis, I see you. Danny, great question there. Okay, let's get to the questions on, let's go back to Facebook and YouTube. Debbie, can you see us? Can everybody see us? I'm seeing a few people that can't see us. Let's go to D-Lynn. How much K2 do I need to take with D3?
How much D2?
Yep. How much? Oh, sorry. How much K2?
Oh, K2.
How much
You don't need D2. You need D3.
How much K2 do I need to take with D3?
I like 180 milligrams of MK7 is a particular form of K2
Okay.
that you need. Remember, vitamin K2, which does not clot your blood like K1. K2, what it does is it helps the vitamin D bring the calcium into your bones, not your arteries or joints. So if you're taking vitamin D3, which you should be, you want to take vitamin K2 with it. And I like 180 milligrams of MK7.
All right, D-Lynn, thank you for that. All right, I'm getting used to my setup here. Let's see where we are at. And I'm going to go to Danny here. Does the inversion bench affect eye pressure? That's the thing back there.
Well,
It does me when I'm on it.
Yeah, but not, yeah. I mean, if you have glaucoma, you may want to ask your ophthalmologist about it. But when you first start doing it, there's a lot of, your head turns kind of red, but you get used to it. And I've read where there's really, no danger of busting a berry aneurysm in your head. That's kind of a myth. So you'll be fine, but just get used to it by tilting. Don't go 180 the first time you do it. Go 90 and then, get used to it. But I can hang upside down for 10, 20 minutes if I want.
Really, I do feel pressure in my
Sure.
head.
You don't do it a lot though.
Thank you for that, Danny. Let's go to, I saw, where is she? I saw Linda, and I was with Linda last night. Linda, it was so good to see you.
Thank you for that meal. Linda.
Yes, thank you. Thoughts on acromansia? My oncologist suggested it for me. Did I pronounce it right?
Yeah. That's a, I'm pretty sure that's a probiotic that I like. When somebody's gut's dysfunctioning, I always tell them to get on some acromansia. You've got a really good oncologist that knows about integrative medicine. If your oncologist recommended that, and as you know, gut health, and that's the main reason I use acromansia, is gut health. So that's a great recommendation for you. There's a lot of people that think our gut microbiome really controls most everything about our health. Matter of fact, you have more DNA in these gut bacteria than you do your own DNA. So it really, in a way, controls your brain. There's a great article this week about how your gut microbiome can be a cause of anxiety. It was in Medscape this week.
Really?
Mm-hmm. Your gut bacteria can tell your brain what to do. And remember, 80% of your immune system is located in your gut. So if you're got a lot of dysfunction of your gut because of bad bacteria in there, it really can lead to a lot of bad things, not just autoimmune diseases, but brain fog. It's not just leaky gut. It affects everything. Heart disease, cancer, because you're trying to tampen down inflammation. And that's why your oncologist is suggesting that. That's a great thing.
Linda, thank you for that question. So good to see you last night. Angie on Instagram is asking, I purchased liquid methylene blue, the drops. How many drops do you suggest, and is it okay to have every day?
Yeah, I'll take it every day. I'd start out at, assuming that you're not on any serotonin reuptake inhibitors like Prozac, Zoloft, Paxil, those things. If you are on those, or an MAO inhibitor, which I doubt you're on, but you have to start out slow because of a risk of something called serotonin syndrome. I've never seen it as a doctor, never. You'd have to be on huge doses. So I have people start out at 8 drops a day, which is 4 milligrams. And then in a week, go to 16 drops. If you're having a lot of problems, then go to 32 drops. And that's still a low dose.
Yeah.
We learned to use it during COVID. It really helps. I take it every day.
I take it every day too. I take the NeuroPro Plus, the pill.
That's the one I take now because it's got the vitamin C in it. Remember, you need to take vitamin C along with it. It makes it work better.
Yeah. Thank you for that, Angie, on Instagram. Let's go to Jerry on YouTube. If I did it right, there we go. What's your thoughts on cryotherapy for breast cancer?
I don't have any experience with cryotherapy for breast cancer. I've read about it, some promising studies on it, but I haven't had a patient that's done it. So you need to do the research on that and see where you're going. A lot of people do it for liver cancer as well. But, I'm not expert enough on the cryotherapy to tell you whether to do it or not. So you're going to have to get a little deeper on it and people that are used to treating it with that. But
Jerry, thank you for that question. Cryotherapy, I've done it before. It's actually, you feel good afterwards, that's for sure. Middle Tennessee, Nashville, where are we at, Middle Tennessee? Hello, Ben and Doc. Do you recommend a supplement for prostate inflammation and foods to and not eat to help as well?
Yeah, prostatitis is fairly common, hard to diagnose, hard to treat, because most people think it's not really caused by a bacteria, even though the standard treatment is to put you on a month of Doxy or metronidazole, heavy hitters that can also really mess your gut up. But, I've had it myself. And as far as recommended alternative things, supplements, I like saw palmetto. I like stinging nettle root. I like black seed oil. I like black pepper. I like MSM. I like turmeric. I like pygium. I like Pectosol. Pectosol C, which is citrus pectin, is one that I take daily. That's one of my normal supplements that I take for that. Foods to eat, just stay away from the inflammatory foods like sugar, gluten, dairy, nightshades, things like that. Balance your gut. And I read a report today. This is interesting because I read a report today on enlarged prostates. You know what may be an effective treatment for that is GLP-1s.
Really?
Yeah.
Huh.
They may have an effect, not really as much as to shrink your prostate from BPH, but rather as an anti-inflammatory.
That's so interesting.
I'm going to get on a small microdose of tirzepatide myself.
Really?
Yeah, for aging purposes and inflammation. I've had so many people tell me that I put on that for weight loss or diabetes that say, my joints don't hurt anymore. My back doesn't hurt anymore.
Yeah. Yeah.
So it kind of makes sense because it's acting on that visceral fat. That's the fat around your internal organs. It's like an organ in itself. It's an inflammatory organ. That visceral fat is an inflammatory machine. So if you see somebody with belly fat, they've got so much inflammation going on. It's hard to believe. That's why these GLP-1s work. I love it. GIPs, they work.
When you say microdose, do you know, like, how will you?
I'm going to start out at 0.75.
Okay. Okay.
And
once
again, the starting dose of that is 2.5 milligrams. Once a week, I'm going to do 0.75 milligrams.
Okay.
Way, way lower than the starting dose.
Okay.
That's what I've read reports of. That's what I'm going to try. Stay tuned. I'll let you know if it's helping me, because I definitely have, my back is not great. When you get this old, if you're as active as I am, you're always tweaking something. You could get hurt in your sleep at my age. You could turn over in bed and get hurt. You could hurt yourself. And that's not falling out of the bed. That's just turning over.
Thank you for that question. We're going to get to Barbara here. My alkaline phosphate has been elevated for about a year now. Should I be concerned? I had a CT and have a cyst on my liver that has been unchanged since 2021. What else might be the cause? Is there a diet or supplements I should be taking to resolve it? That give you enough context?
Yeah, that's you think when you think an elevated alk phos, you think either bone or liver. So they've done a CT. I don't think the cyst on your liver is going to cause that. It'd be unusual for it to. That cyst is probably incidental unless it's huge. Then maybe it is affecting your liver function. It'd be interesting to see what your other liver function tests look like the GGT, and look at some of those to see. But think about bones. If they've ruled out a liver cause, if the rest of your transaminases are normal, like your ALT and AST, and GGT, which is really more specific for alcohol damage, then if all those are normal, start thinking bone. Now, I have seen a few people that just have a high alk phos and never found a reason for it. Now, remember, if you're a teenager, your alk phos is going to be out the roof because your bones are growing. So a lot of people say, my God, this patient of mine, has a alk phos out the roof. Is he bone cancer or liver cancer? Well, he's 15 years old. No, that's normal for that age group. So look at all the rest of your stuff. If you're having some bone pain, you might even consider getting a bone scan. But if it's been there a year and it's not keeping going up, it's probably not going to find a cause for it, but certainly look at bone health.
Barbara, thank you for that question. Great question. Let's get to Evangeline real quick. Evangeline's asking, so I either pulled a muscle or a tendon in my upper rib cage or ended up with costochondritis from having my wife walk on my back. Does that mean I should avoid lifting weights? Great question, Evangeline. What's your thoughts on this?
I prefer the goat yoga. Don't let a human being walk on your back. Have a goat walk on your back. Human beings are too heavy for that. Your wife's probably very thin, but you think that was funny? Have you seen goat yoga?
I've
seen it in person.
Have you really?
Yeah, I didn't do it, but these goats actually walk on your back.
And
it's a highly expensive type of yoga. People love it.
And you do like yoga moves while the goat's on?
Yeah, you're doing a plank, a goat's on your back.
Oh.
So it's kind of, I don't think I would have anybody walk on my back that didn't know what they were doing. They could do more damage. So you pulled a tendon in the upper rib cage, or ended up with cause from having. So you're not sure what the cause, what it could have been. It could have been your wife walking on your back. So yeah, if it hurts to lift weights, you should avoid it because you're just irritating it. And really, costochondritis, which is inflammation of that material, that the cartilage that holds your ribs together. You ever eaten a rib?
Yeah.
The meat between the ribs.
Yeah.
That's what it is. It's been pulled, separated. So you have separated fascia, really, between those ribs, and it's painful.
I bet that's super painful.
I've had it, and it's really, in some cases, chiropractors can sometimes help you with that. Sometimes you may have a rib that's kind of out of place, and if they really know what they're doing, they can help you with that.
Yeah.
But I'd certainly use a combination of ice, heat. I would use some good salves on it, like the Blue Emu. I love Blue Emu.
Yeah.
With lidocaine.
Yeah.
That's one of my favorites. It'll get better. It'll just take a while. It'll take a month to get better. So you could probably do legs or something like that. But I hope, your wife didn't cause it, because it, could cause some hard feelings and things.
This is true.
We were talking about, I have a little joke for you, talking about women.
Okay.
And one of my patients told me that this is quick, and I thought it was pretty funny. What do bacon and women have in common? There's 3 things. Bacon and women.
I love bacon.
Yeah, they both taste good. They both smell good. And eventually they're going to kill you. You like that, didn't you?
That was good. That was good. Evangeline, thank you. I hope that helps a little bit. We're going to keep moving. Let's see where I am at. Thank you guys for all these questions. If you're new here, let me know. Let me know if you're new to the show. We do this every week. every Tuesday, 7 to 8. Let's get to Karen here. Karen, thank you for being with us tonight. When it comes to gut health, what's your recommendations to start a healthy gut? A baseline test, then add particular vitamins, and when to repeat tests. What symptoms should we be aware of? I love this question, Karen, because we're saying how gut health is the kind of the root cause of everything.
That's where it all starts.
So how do you start like monitoring it?
Well, you see, first thing you do is when a patient comes in the room, I ask them about their gut. Do you have bloating, gas, abnormal bowel movements, GERD? Are you nauseated? Are you inflamed? Are you having you feel like your gut is poking out when it shouldn't, when you haven't eaten that much, which sometimes means just a lot of bloating. Baseline test, the best one to do is a GI map. We do those a lot. And they actually kind of map that gut microbiome out, and including the good and the bad bacteria. It looks at H. pylori, it looks at Candida, it looks at SIBO. There's a lot of things that you can really learn from that GI map. It's fairly expensive. Insurance doesn't cover it, and I usually reserve that when somebody's really having some problems.
Yeah.
As far as the vitamins, my best gut pill by far that I've ever seen has got to be Digest Shield.
Yeah.
I mean, I take it every day. It's got the prebiotics, which is food for the probiotics, which it has 11 types. It has lactase that breaks down dairy. It has chitosan that breaks down lectins and glutens. It's just and it has the digestive enzymes to help you break down, especially those fats that you may have a hard time breaking down and digesting, especially if you don't have a gallbladder. But even if you do, that's just if nothing else, take Digest Shield.
Start taking Digest Shield.
And look at what you eat, what you tolerate. Everybody's a little different too. Some people have to do other things like colostrum. Kelly asked me about that tonight, or the raw milk. I'm a fan. So there's a lot of stuff you can do, but be aware of your symptoms.
Yeah, I think that's Karen. What I'm hearing is like just starting to listen to your gut. Like be aware of I ate this and I felt this way a day later or a couple hours. Is there a time period you look for when like your gut's going to be messed up a day after, or is it all random?
It's pretty random. Some quick, some are delayed. We also do this thing called a Dunwoody food sensitivity test that is pretty good, because a lot of foods you won't react. That's a good point. You won't react right away. It's maybe 2 days later. You can't figure out why you have brain fog. Your gut's not working. You feel tired. It's because 2 days ago you ate wheat or something like that really you're very sensitive to. So that's a good test to get, my Dunwoody. And sometimes what I've found is the foods that you crave the most are the ones you're the most sensitive to. It's crazy, but
it's cruel.
That's
cruel.
That's very cruel. So a lot of times I'll look at those.
Karen, thank you for that question. Let's get to Mark here. My brother Mark, increase in bone fractures among under 60 is a troubling trend. Risk ankle and vertebral fractures, bone scans, DEXA in middle-aged patients are revealing more cases of osteopenia or early osteoporosis than expected. Some believe it's COVID side effect. What are your thoughts on this?
Yeah, I agree. We're seeing a lot more of it than we used to. And a lot of times, to me, the main cause of osteopenia, which is really a normal thing for women that are menopausal, it's almost, they come into me all the time. I've got osteopenia. My God, I can't believe this. I go, well, you're just normal. I see very few women that don't have osteopenia, and usually it's because of lack of hormones or exercise. You don't need to take any extra calcium, and do not get on those bisphosphonates that they push on you. They don't build the right type of bone. There's osteoblasts that build bone, there's osteoclasts that break down bone, and usually it's a problem more with you're building the wrong kind of bone with these bisphosphonates. They're terrible, like phosphonates. I never use them. And now they're coming in weekly or monthly shots. I don't like them either.
Yeah.
I like the old fashioned way. And vitamin D with K.
Mm-hmm.
So there's a lot of ways. So don't freak out if you got osteopenia. That's not a big deal. But certainly we're seeing a lot younger people because remember COVID messed people's hormones up.
Yep.
Threw them into early menopause, caused a lot of miscarriages, caused a lot of PCOS. So always look at the hormones with that.
Mark, thank you for that question. I want to go back to Facebook real quick from Becky. Becky, what's going on? Always enjoy the show. Thank you. Thank you so much. Have you read Dr. Aman's What Your Doctor May Not Tell You About Fibromyalgia? And what do you think about the guaifenesin protocol? Also, I know LDN is used a lot for fibro, but what do you find works the best for most people?
I haven't read that book. It
Yeah,
makes me want to get it.
Yeah.
Guaifenesin, I have heard people using that off label. It's an expectorant. It thins your mucus out for sure. But I haven't looked at a particular guaifenesin protocol for fibro. A lot of people like guaifenesin for some reason. It's in cough medicines. I think there's some pain relief with it. Some people can abuse it as well. Now, LDN I am familiar with because I use a ton of it for fibro. I love it for fibro. I love LDN for long COVID. I love it for most every autoimmune disease. I love it for arthritis. We use it for weight loss. We use it for sleep. It's a great product. So I use a lot of low-dose naltrexone for fibro. What works the best for most people? Again, in integrated medicine, we always try to find the root cause of the problem. And I'll be honest with you, with fibro, there's a lot of times there's a lot of trauma and a lot of, if you listen to the podcast I did today with Dr. Ben Edwards, if you ever listen to one of my podcasts, please listen to one of those two I did with him. And it's just fantastic. We talk a lot about this, the emotional part of fibromyalgia. A lot of people think fibromyalgia is brought on by any kind of trauma, whether it's emotional, physical, whatever. Certainly, we think COVID kicked a lot of it off. Usually happens more in women. But one time I was at a conference, a rheumatology conference, and there was a famous older Stanford professor who was lecturing on the various rheumatologic diseases, like we talked about PMR.
Yep.
He talked about lupus, RA, Sjogren's, all the major ones. And somebody asked him about fibro, because that's the dreaded word in medicine, because we don't know what causes it. It's probably just a name for something we don't know what is. I think it's a real thing. There's no doubt, but it may have more emotional content than you may think. But anyway, so he said, and he actually said that this was many years ago, and he said, and there's only one treatment for it. And everybody, you can see all these doctors getting their pen right out, because this could help so many people. He said, exercise.
Really?
I'll never forget that. Things stick out in my mind. He was a very famous guy. Yeah.
That's interesting.
Yeah. But, I'm hoping that the GLP-1s will help as well.
Yeah.
So we're finding that they help migraine headaches. There's a lot of adjunctive uses for the GLP and GIP agonist. It's eventually most people will be on them. Did you know 1 in 10 Americans are now on one? 1 in 10 are already on it.
And you feel good about that? Like, what's your?
I do feel good about it.
That's interesting.
It's a medicine. It mimics a natural gut hormone.
Okay.
Glucagon-like peptide. So in a way, it's a natural type of treatment. And of course, there could be side effects like nausea. I haven't seen any pancreatitis with it. It's been reported. It's not going to cause thyroid cancer. You don't want to give it to anybody with a particular type of thyroid cancer called medullary thyroid cancer, which I've never seen a case of it. Neither has my brother, who did thyroid surgery for 30 years. So it's not going to cause that. but they warn you about MEN syndrome #2, or if you have a family member with it, avoid it. But for most people, it's very safe, very effective, and it can cause constipation, and some nausea. But here's the side effects: about half the amount of heart attacks, half the strokes, complete reversal of non-alcoholic fatty liver, reversal of chronic renal disease of diabetics, less dementia, less cravings for cigarettes, alcohol, drugs.
Yep.
These drug rehab centers are going to be using it at the Wazoo, I predict. I know they will.
So
I predict the cardiologist, the GI guy, the rheumatologist, they're all using it now. The renal docs, and I predict the pain medicine docs are going to be using it.
That's so
And the
interesting.
rheumatologists are already picking up on it. So yes, it's really interesting. Cardiologists use it out the wazoo.
That's so interesting to me.
Yeah.
That's
It's
exciting.
great longevity.
Thank you for that question, Becky. Let's get to Tom here. Let's see if that went up. There we go. Did I get you? Why is that not showing up? There we go. I bought a multivitamin for MTHFR patients that have issues with the methyl vitamins. Any chance you would ever develop one? Would rather buy it from you than some left coast liberal.
I love the way you put that.
I will send Andy and Amber the details when it arrives this week.
Oh yeah, let me know.
Yeah.
Yeah, I would like to, because myself having the double mutation of the 677TT and an increased homocysteine level. Of course, I take methylfolate, methylcobalamin, which is methylated form of B12, and I take B6, and I take trimethylglycine, and it has lowered my homocysteine level. But yeah, I'm taking a lot of stuff now. The methylated B vitamins are in my super vitamin,
Yep.
but I would like to get a combination product. Before I make a vitamin, I want to make sure it's potent and has all the milligrams that you want in it. And I want it to come from these guys in Oregon. These guys are not left-leaning West Coast liberals. These guys are conservative guys that just do it right. And they source all their products from either the U.S. or some in Europe, not China, not India.
Mm.
I'm reading a book right now called China RX. And that's a scary book. I'll do a book review at some point, but 80% of our medicine, our ingredients for the medicine, come from China. So if you get most of the vitamins, and certainly most of the heavy hitters, including heparin that we use in the hospital, all these medicines we use in the hospital, that actually there's been some tainted ones. Look at what happened with COVID. I don't trust them that much. But in any event, I'm getting on a ramble, but you can if you put the ingredients together in America, even though they're sourced from China, you never know where they're coming from. They're probably coming from China, even though they say made in the USA. The ingredients themselves can come from China. Usually do come from China.
I'm with you.
Read this book. It's really scary, because if they want to destroy our country, that's the way they can do it. Is through tainting our medications.
Mm.
We can't do without them right now. So maybe that's why Trump is being a little bit more nicer this week to China with the tariffs. But anyway, what I'm trying to tell you is where we source them from, Freedom to Formulate, think about that name, is there are no fillers in them, and they're domestically sourced.
Mm.
And there's not any maltodextrin, cornstarch. Even some of the better vitamin companies are starting to use these things. And that's actually one of the main reasons I did it, because I met these guys, and they also can put the stuff in combination that I want. Like the super has, 1,000 of C, the good C. It's got the natural E. It's got all the methyl Bs. It's got the A. It's got the lycopene, the horsetail. It has, there it is. It's got all that stuff. The zinc you need, especially if you're on T. Selenium, copper, manganese.
And like you said, the big thing you're talking about
D with K.
is the amounts.
5,000 with D with K. So I put a lot of stuff in that super, but certainly I appreciate you mentioning that. But yes, I would like it, because I'm a person that has the worst methylation gene that you can have. And it certainly can lead to increased rates of heart attacks, miscarriages, strokes, So it's a big thing that most doctors don't even know what that means, and they
Yeah.
certainly never check a homocysteine level.
Yeah.
And that, to me, homocysteine, which is an inflammatory marker, is way more important than what your total cholesterol is. So maybe
interesting.
look at that. It's on the Cleveland that we do.
Thank you for that question, Tom. Let's get to Christy here. Thank you, Christy, for being patient with me. Best diet for post-vaccine syndrome. I'm 11 weeks into the Independent Medical Alliance I Recover protocol and currently fast like suggested. Hoping to optimize my results with diet. Also a type 1 diabetic. What's your thoughts here for Christy?
Yeah, post-vaccine syndrome. It'd be interesting to know which vaccine caused it. Was it a COVID vaccine? It could be a flu vaccine, which I certainly haven't taken for years. And anybody, in my opinion, that gets a COVID booster now just doesn't know what they're doing. They're putting their lives in their own hands. It's just absolutely crazy for anybody to be getting a COVID booster now. They don't work. They're dangerous. And while they're giving the 6-month-old babies, I'll never know.
Yeah.
It's almost criminal to me. But so, there is a protocol. We like McCullough's protocol that has a lot of things. We've printed it up. I don't know if we have it printed up here, but several things that we use. Also, like the natural stuff you can do, like the fast. I like the gut protocols. I use a lot of ivermectin for that. I use a lot of sweating, anything that can detox you, like an infrared sauna. I love the red light that I've brought on here many times. So I like hyperbaric oxygen. I like glutathione. That's a good role for NAD plus to stimulate that. So there's a lot of ways to do it. I like the IV vitamin protocols that we do. Certainly, vitamin D is a good detox vitamin. Vitamin C is. So you'll be fine. I love methylene blue.
Yep.
I like I said, LDM. All those things will help.
Christy, I hope that helps a little bit. I'm trying to see where we are at. Oh, Murfreesboro, Middle Tennessee. I see you. I love Murfreesboro. Okay, we are way behind here. I'm gonna try and knock out a few as quick as we can over the next couple minutes. We're gonna have to call it an evening here shortly. Let's get Kathy real quick, and Lisa, I'll get you. Have you had any success with treating long COVID patients, or is it just treating symptoms?
No, we've had great success with it. We love treating long COVID. We treat it every week. We also treat at least 1 to 2 vaccine injury cases a week. And we treat them a lot alike. But a lot of times we use a lot of different strategies. We certainly ask about symptoms because sometimes that leads you to what part that it's affecting the most. Like, is it shortness of breath? Is it brain fog? Is it fatigue? So a lot of times we'll go after those particular ones. Look, we've got our dog wanting us to get up here and get on camera with us. There's Izzy in the background too. But certainly ivermectin. We use a lot of methylene blue. We use a lot of LDN. Those are our 3 biggies that I would say we do. But we also use a lot of anti-inflammatories. We treat the gut. Digest Shield's proven to be really good for long COVID patients. Even you can do things like hyperbaric oxygen. I think that's another good one. But certainly get on a good vitamin protocol and look at Dr. McCullough's vaccine injury protocol. I use a lot of that for long COVID patients as well. I treat them very similarly. Nicotine patches, we use a lot of those for that. Believe it or not, it seems to work pretty good.
You mentioned LDN. I saw in the corner of my eye a question around what is it. Can you just explain what LDN is real quick?
Low dose naltrexone, which is in high doses, we use it for drug and alcohol patients that it kind of blocks the high you get from that. So, but low dose really works in a completely different way. We're talking about very low dose.
Yeah.
It kind of tricks your brain into releasing its own endorphins. and healing factors. It really is an amazing product. That's one of the main things you can do for a lot of these adjunctive treatments, especially for inflammatory states like long COVID.
And if you're interested in diving a little bit deeper into LDN, we've done a couple different episodes on our YouTube channel. If you search for low dose naltrexone performance medicine, you'll have an explain this with Robin Riddle. I think you've done an episode of Common Sense on MD on it. Real quick, I see Max was asking, what brand of methylene blue do you like? Is there
I like the Neuro Protect. I forget who makes that, but it seems to be really good.
NeuroPro Plus, and you can find that on our website if you just want to see what the brand is. It's on performancemedicine.net. And then the other one is, I get asked, it's BPH. BPH is the drops.
No, BPH is pills or shots. We have BPH in our offices. I don't think.
Is that not the methylene blue, the drops?
No, the BPH is body protection complex.
Oh.
Methylene blue drops is, they may be made by a company that starts with a B. But
it starts with a B.
It may be.
I thought.
Yeah, I'm thinking you're saying BPC 157. Yeah, completely different. It may be BPH.
Real quick, let's get this for Lisa here. Lisa always shares the broadcast. Thank you so much, Lisa. Suffering from diarrhea since colon resection / anastomosis. End in January, happens day and night without warning. I'm so frustrated. Imodium like M&Ms. Any suggestions or something I can do or take for this? That's tough.
Digest Shield for one thing.
Yeah.
Looking at the diet. Yeah, it's called short gut syndrome. It usually gets better. So, take hope. It may take a year. We knew you were having some of the issues, and that will help, but you got to give it some time. And the other thing I would do, of course, is do some intermittent fasting. I think that always helps.
Calm the bowel down.
Yeah, calms the bowel down a lot. You may want to take colostrum. You may want to take BPC 157. Those are things you could do. Believe it or not, you could even try a little bit of a shot of raw milk if you can get it.
Yeah, that's interesting. Lisa, we're thinking about you. Please keep us posted each week with how you're doing. Let's get for Amanda here, then we'll call it a night. Can kidney stones be hereditary?
Yes, no doubt. No doubt they can.
Thank you, Amanda. Real quick, I know we're
if you do have kidney stones, think about a low oxalate diet. We've done a podcast on it because most of them are made of calcium oxalate.
Let's get this for Amber real quick. Amber's with us each week. Thank you, Amber. Do you think birth control helps with hair loss or does more harm? My estrogen and progesterone is very low at the moment, and I've been on birth control for years, but I'm having excessive hair loss even though I've already taken minoxidil and spironolactone.
Yeah, I don't think birth control pills are helpful for hair loss. I've never seen that really. I think in general, hair loves estrogen, but doesn't like synthetic estrogens or progestins. But it hates testosterone and DHEA. That can cause hair loss. But again, you got to look at all the factors from your nutritional status, gut health, to checking all your hormone levels, including a DHT level. That's what you're trying to block down with the spironolactone. Minoxidil is Rogaine in pill form, which I think is great. So I like to look at your thyroid, look at your iron levels, look at your insulin resistance numbers, look at your inflammatory markers. Get a Cleveland if you want. And the other one, sometimes that I'll add, besides we do have a bond I put together called Happy Healthy Hair.
Yeah.
That's really, I think, way better than that one they always advertise on TV. Was it Nutrafol or one of those?
Yep.
Look at the ingredients. I think it's way better. The other thing, you can take some omega-3s, and sometimes I'll add finasteride. Unless if you're of childbearing age, you don't want to take finasteride in case you got pregnant. It's teratogenic. You can't do it. But if you're not of childbearing age, or if you've had a tubal or that type of thing, you could possibly consider that in the hands of somebody that knows what they're doing. But try to find out the root cause of it. There's always with women, you can always get their hair thicker.
Yeah.
We even do PRP injections in the scalp a lot
Yeah.
of times for this. And also red light therapy for scalp is fantastic.
Amber, thank you for that. And I'm going to put this up real quick from Lotto, just because I know you're doing some research on DMSO, looking for IV human dosage, reading bought DMSO handbook, a new paradigm in healthcare. Any resource information for Lotto here?
Go to the Midwestern,
yeah.
a Midwestern doctor. It's going to be hard to find it. But yeah, it's not really a new paradigm. DMSO has been around for decades, and it's a great healing tool. So I hope to do a podcast on it soon. And I hope to be able to source it, because you can do it PO. It's, you usually think of it as rubbing on you to get things in, because it's a great transport vehicle. But IV doses are really good. Check out the Midwestern Doctor's blog. Fantastic. Very complete. And he always updates it.
Thank you, Lotto, for that. I want to put this up just for our Bristol team. Shout out to the awesome ladies in the Bristol office that got my pellet today. Thank you, Rose, for the sweet comment. It's amazing. We love the Bristol office. Is just amazing. Shout out to the crew over there in Bristol, Virginia. I'm Rachel. I see you. Thank you so much for being in here tonight. Krista, thank you for that comment. Steve's wanting us to tune up the guitar. I agree. I love that, Steven. Okay, guys, how'd we do? I know I missed a little bit. I see you, Diane. We'll talk about the shingle shot next week. I'll get to that. Thank you, Carter. Montana, happy Tuesday to you. Thank you so much. We're excited about this week. We're gonna get the whole team together and do some training. Guys, how'd we do? What'd you think? And while they tell us how we did, I see Motaz has given us 11. Thank you.
Motaz is the best.
I love you, Motaz. Real quick, let's get to the shingle. What's your quick thoughts on the shingle shot?
I took one. It's a Shingrex. It's 2 shots. And years ago, I took one and felt awful for the whole weekend. So I decided not to take the second one. But this probably shingles. The thing about shingles is, I mean, anybody can get it. It's had chicken pox. Shingles can be pretty bad. It's not going to kill you, but you know, if it gets in your eyes, it can be bad. It can be very painful. You get that post-herpetic neuralgia. But I'm not taking the second one for sure. Shingles is very treatable too. We treat a lot of shingles, and you jump on it with valcyclovir and prednisone, and most of the time it goes right away. I can't fault you if you want to take it, but as for me, I'm not taking any more vaccines. None. Quote me on that.
I'm quoting you on it.
Do you hear it? I'm not taking any more.
Guys, we love you. Thank you, Lisa. Thank you, Jerry. Thank you, Crystal. Crystal, thank you for being with us. Evangeline gives us a 10 out of 5. I love it. Guys, I'm going to put off the recorder here. This was fun, man.
Good. Thank you.
What'd you think?
Thank you.
What'd you think of this, guys? This was like an in-person, thing. Oh, that's awesome. I see you, Krista, a 4th-year med student at ETSU.
Oh,
Congrats.
Wonderful.
Her daughter is. That's awesome. Yes. Right. Reach out to us, please. I love that. Functional residency. That's awesome. Rachel, can't wait to see you. Carter, thank you so much. We love you. Can't wait to be with you guys this week. We're going to have so much fun on Thursday and Friday. Get to see everybody in one place. Pop, thank you.
Thanks, man.
It's been a blast.
Yeah, that's fun.
What should we do now?
You like my jokes, don't you?
I love your jokes. They're hysterical.
They're better in person.
They're way better. Like the timing was
If you're in Knoxville and it's 100 miles, it just doesn't come off.
The
There's a delay. The timing.
Timing was
jokes are all timing.
Timing, tone. I could tell your facial expression. I knew you were joking.
Yeah.
That was incredible.
Yeah. Thank you, man.
Guys, we love you. Thank you, Amber. Thank you, Steve. I love you. Don, thank you. All right, guys, we'll be back Tuesday, 7 to 8. We do this every single week, answering your health and wellness questions. Join us. Thank you, Sherry. Love you so much. See, Carter's saying you got the best jokes.
I do. Thank you, Carter. Thank you, Carter.
All right, I love you. Instagram, we'll see you guys next week, 7 to 8 on Tuesdays. We answer all your health and wellness questions. Brad, send us out of here. Where are we at? Where's my outro? I always miss my outro. Brad Blackwell, get us. Here we go. See you guys. Love you.
Don't go away.